Self-care does not mean no care. This event marks the International Self-Care Day, which is being celebrated today. On my next slide, I was a sort of presentation about myself. My name is Luís Lourenço. I'm a community pharmacist from Portugal. I'm currently serving as a professional secretary of the International Pharmaceutical Federation, and today I'll be the moderator of our event. As you can see on the next slide, you have an extraordinary panel of specialists who will be able to share their expertise during this session. I will have the opportunity to introduce all of them prior to their presentations. And as always, you have a couple of housekeeping rules just for you to know what's going on, how I'll actually going through this webinar. So this webinar is being recorded and live streamed via YouTube on an FIP page. The recording will be available to our members on our website, events.fip.org. You can put your questions. You may raise your questions using the question box. The presenters will try to answer your questions on the presentation box. If not, they'll come up with a question and then they will clarify it at the end during our discussion time. You are welcome to provide any feedback through our email address, webinars@fip.org, not only about this event, but with ideas for other events or webinars. And then, of course, if you're not a member of FIP, we welcome all of you just to become a member of the Federation. And you have here the address that you can use to actually register. And I would like to inform you that this year we're going to have our event, our major event, our annual Congress being held in Cape Town. That's why I have a picture of Cape Town behind me. I would love to be there, but not yet. So that's an extra motivation to become a member, or if you are already a member, it's still on time to register for this event. So moving forward with our presentation as a sort of a background, in our next slide, we have here precisely the information about this self-care month. I don't know, I think there's probably an issue here. Maybe the slide can be changed, please. Well, anyway, well, I can give you the information in the meantime. I think we have some technical issues are being solved. So, oh, here it is. So, I was saying every year, the weeks from June the 24th to July the 24th marks the self-care months, focusing on increasing awareness of this subject and available interventions, celebrating current achievements and calling to renewed commitments and actions to expand health systems to include self-care interventions. To mark the 2024 International Self-Care Day, this digital event highlights pharmacists' important and exciting role in empowering self-care and ensuring that patients do not feel neglected. In our next slide, we'll just inform you all that we need to thank Racket for supporting this online event and also moving forward with the objectives on the next slide. So what we attend with these webinars, at the end, we would like to attendees to learn about the concept of self-care, the global trends of this practice and its accrued benefits, the role of self-awareness in self-care, the continuum from self-care to professional care, common self-care practices, activities that pharmacists can be involved in or recommend, and how pharmacists may promote an holistic approach to healthcare in their community and communicate that self-care does not mean no care, as is mentioned on the title of this webinar. On the next slide, we have the alignment for this session. We have, well, the presenter from Austin, the public perceptions of self-care between empowerment and abandonment. Then we move forward to self-care versus professional care, understanding the balance. Charlie Mary Modge, emeritus professor, who actually has a very known friend of FIP and for more of all of us, we'll go through this topic. Then we move forward with Busy Bright, focusing on health literacy as a self-care empowerment tool. Then we end the part of our panelists with promoting a holistic approach to healthcare through pharmacy with Kais and Yap. And then we'll share from the FIP Secretariat, we'll share some information about the new FIP resources, our self-care, and then you open the floor for the Q&A, and I will actually have a wrap up right afterwards. Also on the next slide, I'll give you some information about where this webinar fits with the overall structure of FIP. As you know, we have since 2021 set the FIP development goals. This webinar is covering development goals number 18, 14, and 15, so that we know that we have collected and is still collecting all the activities that have been run by the Federation regarding different topics. And it's worthwhile to actually go through our repertoire, where we have a set of events focusing on different areas, on different development goals. And with no further ado, move forward to our next presenter. I'll give the floor shortly, Dr. Austin L. Osta, sorry, misspelling, who's the director of self-care academic research unit at Imperial College London in United Kingdom. Austin's not proper. I'll give you just the short CV, but his long CV will be available on the chat box. So I'll give the floor to Austin. Thank you so much for your time.
Thank you, Louis, for the introduction. And thank you, everyone, for inviting me to. It's my pleasure to be here today and to present. So my name is Austin. I'm director of the Self-Care Academic Research Unit. And I thought it would be good to start, as Louis and colleagues suggested, to really give an overview of what self-care is and the link, what are people saying when it comes to self-care? Is it empowerment or abandonment? So I'll have 10 minutes to do this. Thank you. So we want to start by looking at the importance of personal empowerment and self-care and tackling diseases of the lifestyle that we're all familiar with. We want to also look at the easiest ways to conceptualize self-care, because definitions could be confusing, and also to remember the growing self-care movement in the UK internationally. And finally, we want to look at people's attitudes, perceptions, knowledge, and behaviors when it comes to self-care. So the Self-Care Academic Research Unit was established in 2017 and is a collaboration between the Self-Care Forum UK and the International Self-Care Foundation and Imperial School of Public Health. We were established to revisit the oldest type of care, self-care. We want to make the absolute case for self-care. You will hear later from our colleagues about the social and financial return on investment potential of self-care. But we wanted to revisit this oldest type of medicine and do develop some thought leadership around that. It's my pleasure to be connected with the FIP and other sort of key players in this space. Immediately, we noticed when we began to research self-care that there are many, many definitions, and self-care is often used interchangeably with other terms like self-management, patient activation, self-efficacy, and otherwise. So, in the academic literature, we found that there are, in fact, 139 definitions in 2011 of self-care. So we knew the last thing we wanted to do was to introduce a new definition. And in simple terms, we realize that self-care can help us prevent, delay, or alter the trajectory of common diseases of lifestyle. We also recognize that the WHO has many definitions of self-care. Here are only 3. There are, in fact, 5 altogether. And the WHO is now developing a more developed, next year there may be another definition of self-care. But you see here that there are many ways of looking at it. So we felt it was best to get our head around it by conceptualizing self-care using simple frameworks. This is the self-care continuum framework, which was published by the Self-Care Forum UK in 2008. It shows the ideal placement of individuals on the far left of the continuum, where there's green, we're happy, we're healthy, we can make our own decisions, we could have our own lifestyle, and we could, do the things we want to do best. This continuum is basically the context of resource utilization. So if you go on a skiing trip and you break a leg, you will slide to the middle of the continuum where you'll need support, maybe over-the-counter medicines or prescription medicines. You'll be in someone and nurse support, and then you will slide back to the left. So this is a moving scale, and throughout our life, we may move along the scale. People with long-term conditions are somewhere in the middle. They can still self-care, but they would need over-the-counter medicines and regular visits to their healthcare professional and the pharmacy, of course. And then people on the far right, it's the worst place to be. They can't self-care if they're in trauma or if they are very young and so on, or mental health conditions and so on, some severe mental illness. So this is one way, a helpful way to conceptualize self-care in the context of resource utilization. So the more you are to the left, the less resources you need, the more independent you are. The other very convenient way to conceptualize self-care is represented here by the 7 pillars of self-care framework. It conveniently brackets the mid-level activities that we can do on a day-to-day basis to self-care, starting with the first pillar, the key in the ignition, knowledge and health literacy. Then we have mental well-being, then physical activity, and the central pillar of healthy eating. We then have risk avoidance, good hygiene practices, which in today's world isn't just toothbrushing and hand washing and so on, but maybe even, for example, limiting blue light before bedtime from the devices we use. And the biggest pillar of all, and that's maybe most relevant, I think, as pillar one to pharmacy, the pharmacy landscape, is the rational use of products and services. Now, this includes over-the-counter medicines, vitamins, mineral supplements, prescription medicines, but even things like digital technologies, point-of-care tests, individual diagnostics, or even the built community like parks and green spaces. So this conveniently summarizes or helps people conceptualize self-care in a way that's easy to understand. Because of this, we translated the 7 pillars of framework into many languages. You can download these from the ISF website. And it'll be a great thing, by the way, to put on your pharmacy. It'll be interesting for children, younger people, and people our age to engage with that framework. There are many enablers of self-care. You have gyms, social media, digital could be enabled, of course. Empowerment and choice, we'll come back to that. Of course, the technologies of self-care products and technologies, over-the-counter medicines, and of course, the lifestyle medicine movement. These are all enablers of self-care. The first thing we did at SCARU was to comprehensively review the landscape of self-care theory and frameworks, and we synthesized what we felt was a new point of departure for self-care thinking. This is the self-care matrix. It's the unifying framework of self-care. It basically tells us self-care has 4 dimensions. At the first dimension, at the person-centered level, you have the self-care activities. You've seen these as the pillars of self-care. The second dimension is more related here to the social network and milieu. That's where you have the behavior. So how do you sustain these self-care behaviors on a daily basis? The third dimension is patient-centered. Here, you are a number in a database, and people want to push you to the left of the continuum. You've seen that here in resource utilization context. And the fourth dimension is the macro, built environment, policies, enablers, and so on. So there are many hours in the year, and the opportunity to self-care is vast, but we actually spend very little time if we're healthy with a healthcare professional, and maybe even, maybe a little bit more time with a pharmacist. So it'll be interesting to see, how do we make people expert self-carers? How do we move self-care from theory, from something you know about, to something you do regularly, practice, or something that becomes natural to you in praxis? So how can we make self-care easy for people and communities? To do this, we're looking at self-care from cradle to grave, from 5 to 105. I mean, a lot of us here are sort of, in the 40s and 30s and 40s and 50s. This is the time when we are very independent. But ideally, we would start when, people are young. We would embed health-seeking self-care behaviors from young age, in the home setting, in the school setting, and the workplace, of course, is very important, where we spend 40 years of our life. So, how are employers helping us self-care? We're doing a lot of work in that space at the moment. And of course, as we approach retirement. So behavior change is a very important topic here, as you would know. Self-care is about behaviors, really. So we're trying to find new ways to gamify and incentivize people to self-care more. So obviously you would have heard about the emerging movement of lifestyle medicine. So now doctors can actually specialize as lifestyle medicine doctors, where they can prescribe lifestyle over drugs. That's because the benefits of self-care and lifestyle medicine are huge. We know that through appropriate self-care, you can prevent 93% of type 2 diabetes, a significant proportion of heart attacks, and some strokes and cancers. We know it can reduce all-cause mortality. It can vastly improve quality of life. And we hear later how there's a huge social and financial return investment potential from self-care. So in terms of megatrends and where this is going, I think there's now going to be a real focus with the FIP and others, of course, to see how can we move pharmacies, how can we elevate even further the role of pharmacies and pharmacists as self-care navigators, essentially. No longer is a pharmacy a place where people go and buy things. The pharmacy is a place where people go and understand more about their health and self-care journey. So this is a place where they can access blood pressure monitors, access health information through competent healthcare professionals, and maybe even engage with their self-generated data and use point-of-care tests and so on. So the pharmacy landscape, you would be ambassadors of this self-care movement. We also, the mega trend here of digital pill solutions, all these wonderful apps that we have access to, and the wearables. Now, they're quite common, these apps. People use them to their liking, but they're ad hoc, it seems, and they're not really part of the national system. But increasingly, you'll find that some very good apps that are causing the right behavior change may be actually considered for prescription through the healthcare system. So this is a big mega trend, of course, technology. The other mega trends here, you would have, in the same vein, you have symptom checkers, which are decision support tools to help people understand, do they need to go to the GP, or the pharmacy would be the best place normally to go and get some advice, or do they actually need to go and act in emergency? We have the wearables, the Apple Watches and the Fitbits and so on. Of course, you have the point of care tests and the blood pressure monitors and the glucose monitors, which are really self-care technologies, and they're democratizing. So how can we democratize access to these self-care technologies? I'll give you a brief example. In the UK, we had the NHS at-home program. So basically, this program aims to bring blood pressure monitors to hypertensive patients. The idea is that NHS England bought many blood pressure monitors, and through the family physician, they're distributing these to patients who have hypertension. And the idea is that the patient would then monitor their blood pressure regularly and then fix their diet and take their medicines in order to normalize their blood pressure. So it's really a good example of self-care through task shifting, or as the WHO and others are calling it now, through task sharing. So it's not about abandoning the patient here. It's about making sure the patient has the right resources and information in order to become an expert self-carer without being, wasting time to have to go to the GP all the time. So last year we published this paper in which we looked at, understood how has COVID changed healthcare professionals' attitudes to self-care. We recruited data from 313 healthcare professionals across the UK. This was done with the Self-Care Forum and colleagues. And the response was overwhelming that the importance of self-care seemed to have increased markedly during the pandemic. The percentage of respondents who felt that self-care was very important to their clients increased from 54% to 86%. Personal empowerment and capacity of service users' self-care increased significantly. Of course, you would imagine people had to rely on themselves. And the willingness of patients to engage, poor understanding of self-care, and digital exclusion were the main barriers here to self-care. So we really need to think about this and see what can pharmacists do to help engage more with patients around this, or people in the community rather. How can we improve the understanding of self-care, and how can we, for those who haven't got access to digital or who may be struggling, how can we support them in an easy way? So yes, I mean, there was this section here about one of the respondents said that, it's important for self-care to be perceived, as empowerment and not as abandonment, because there is a risk, of course, when policymakers talk self-care. We don't want the people to think that there'll be no care. So we're now doing the Living Self-Care Survey. This is launched in the UK, but we'll be collecting data from Australia, Canada, Jordan, Morocco, and Thailand. Basically trying to understand what people think. These are community dwelling people now, not healthcare professionals. So please feel free to scan that QR code and participate in the survey if you're interested. So to summarize and conclude, the benefits of self-care are huge, and governments and people are taking notice, which is about time. Remember, it's the oldest type of care, so it's the right time to revisit. And not to abandon the self-care technologies, but actually to use lifestyle as the key foundational adjunct. So lifestyle behavior modification is a huge area of focus today, and that's where we all are. How can we become expert self-carers in a way that's meaningful to us? But it's important, of course, to consider the totality of self-care. So a lot of people and entities come in with a focus on one or two pillars, which is perfectly fine. But ideally, through the 7 pillars of self-care, we remember that there are 7 pillars, and it's important for us to think about each pillar and to see what we're doing for ourselves and others. So, of course, there's this very strong focus on personal empowerment, and how pharmacists can democratize access to self-care information, products, and services. And so happy International Self-Care Day. It's a pleasure to be presenting here today. I hope this was a helpful overview of the frameworks. So today is an opportunity for everyone to celebrate self-care and to reflect on how self-care, the movement, is actually growing with you, and is really rising to the top of everyone's agenda and becoming everyone's business. Thank you, Louis and colleagues.
Thank you so much for your presentation, and also for the motivation to celebrate this day. I'll give some major topics of the presentation prior to our discussion later on. So thank you so much, Austin. And then we move forward to our next presenter. So I'm very happy to introduce you to Emeritus Professor Charlie Berrymont. She's academic consultant from the University of Sydney, Australia. Charlie's CV will be available on the chat box, and I'll give the floor to Charlie. Charlie, it's always good to have you on board. Thank you so much.
Thank you, Louis, for the introduction, and thank you very much for the invite. It's always a pleasure to be amongst FIB friends and global friends. So, look, I mean, I'm going to try and give you a bit of a perception about self-care from the pharmacist's point of view, and how we can change that and how we can sort of become part of this self-care movement. I think Austin has pinched some of my slides, or in other words, I probably pinched some of his. So some of the key messages are very similar. So the basis of my objective today is going to be just to give you a very brief overview in about 10 minutes about some of the international trends in policy and practice. We're going to have a look at a very simple, but I think very pragmatic model for the role of community pharmacy in self-care. Talk very, very briefly about theories and interventions, and then just give you some takeaway messages which you may want to use in your own country to progress the concept of self-care. The basis of my talk really comes from, I'll just come, the basis of my talk will come from a set of themed series from 13 countries. Basically, over the last 2.5 years, what we've been doing, myself and a couple of colleagues, is editing a whole range of papers from 13 different countries. And you can see at the bottom of the slide the different countries involved, and they're from every continent. And basically, this is a view of the authors of those countries. And we asked them to concentrate on certain objectives. And the issues that you'll see here that have come up are very interesting. Most countries, self-care as a policy doesn't appear as such. There's like Austin said, there's quite a lot of definitions of self-care. There's a lot of misconceptions about what self-care is. Different countries use different terms. And when we start talking to pharmacists, they basically identify components of self-care within their professional services. And what you can see there on this slide is a list of all the types of components of self-care that appear in programs. They do not appear as a self-care program, but they're embedded in existing programs. And in some ways that's very good because we're providing self-care across a broader things. But on the other hand, the concept of self-care actually gets hidden within each of these services, and the depth in which self-care is applied within these services is all very variable. If we then look at the main points that come from the 13 papers, and it's surprising because we had countries from Australia, UK, Africa, Eastern Europe, from virtually every continent. But what we see is some very interesting patterns, which are global patterns. First of all, is the lack of the use of the term self-care as part of policy. So, however, self-care is, I suppose, sold or embedded in health policy through other means. So countries have prevention strategy, they have power empowerment strategies, they have health literacy programs. But in all the countries, there was only one country that actually identified a self-care policy. And the second part of it, although community pharmacy does provide self-care in many components, none of the, or very few of the authors of these papers identified that community pharmacy, which is really close to the community itself, has been included in part of an integrated approach. There's isolated cases where pharmacy can be used for promotion of detecting atrial fibrillation or blood pressures, etc. But there's no total integration. When we go and have a look at what community pharmacy believes that self-care is, generally, there's a consensus around the world that self-care is all about over-the-counter medications and non-prescription medications, and dealing with minor ailments. These are people that are coming to the pharmacy, are actually presenting symptoms, and the pharmacist recommends usually a treatment or referral. Not in the sense of the true self-care where we're empowering patients to actually look after themselves. You'll see also, as I mentioned before, that a lot of the programs have a component of it. And interestingly, when we have a look at what the authors told us about the professional organizations, is that they themselves tend to focus on self-care about over-the-counter medications and non-prescription medications. We're not seeing self-care in terms of a holistic way, as Austin pointed out, through the use of the 7 pillars. When we look at what the educational institutions are doing, it's very similar. It's very rare that we see courses specifically on self-care. Virtually all the universities have courses in over-the-counter medications or non-prescription medications, or within chronic medication courses, they include the concept of self-care. But the authors were reporting that there was very little, if no, self-care actual theory or models. And therefore, I think that sort of puts the profession in a very interesting perspective, because there's confusion about what self-care is. It concentrates only in one sector, and therefore we're not serving the community in a broad sense. And that's really irrespective of country and irrespective of continent. In the next slide, what we've done, again, with a couple of colleagues, myself and Sarah Dean Griffin from the University of Newcastle, we've developed a very simple model where we try to explain to community pharmacists that self-care really, from a community pharmacy perspective, can be delivered in many ways, okay? From, the traditional thing that we're thinking about, minor ailments, going to chronic diseases, going to prevention, and then going to detection. So if you're a community pharmacist attending this seminar, you need to be thinking about, well, when the patient comes in to my pharmacy, usually seeking a medication or seeking health advice, then into which of these categories do they follow, and how can I then help that patient through some sort of brief intervention to develop their self-care abilities or behaviors in each of these sections. Now, obviously, there's a lot of enablers for you to do this, and also inherent in the patient. And what you see there is a list of the different major factors or enablers that can assist you in developing your self-care programs in each of these sections. This is a slide that you've just seen from Austin, so I'm not going to spend too much time on it. But what you'll see here is a really excellent diagrammatic way in which you can actually put the whole context of self-care. At the bottom, you see the 7 pillars. And again, from a pharmacy point of view, in which of these pillars do we actually want to concentrate on? Do we want to concentrate on the rational use of products and medicines? Because that's really the major focus of most of community pharmacy activity. It's dealing with products and services. And, when you come to physical fit activity, do you need to refer that to an expert or for hygiene? So in which elements of those 7 pillars do we want to really activate? And this sort of lack of focus in terms of our policy and strategy is very important. Going to the models that we could potentially use in community pharmacy. This is just a brief literature review that we undertook, and there's a lot of models that actually can be used in pharmacists' continuing education to be able to assist us in actually delivering self-care services. It's not good enough just to have a model, but associated with the models, what we need to have a look is at very, very specific interventions that we can actually deliver in our day-to-day practice or within our policy frameworks, either at university level or at professional organization level. And this is an excellent paper where there are 10 major interventions that can be applied, and obviously won't go through each of those, but you can see that there are very specific interventions that can be used in self-care policy or self-care delivery. And the major question is, where does the balance lie? Again, going back to Austin's view, is it patient abandonment or patient empowerment? What we know, and there's lots of evidence to essentially point us to say that if we empower the patient with self-care behaviors, their clinical outcomes are much, much better. So it's really important that when you are dealing with a one-to-one patient in your community pharmacy setting, that you target your advice to that particular patient. There are individual patient-specific needs and wishes. There are some patients that wish to spend quite a lot of time with you, that are very happy for you to give them advice, and therefore you can have a look at their needs and wishes quite in depth. And there are other patients that will come into your pharmacy and want to get out within 30 seconds. But you need to have interventions for each of those. The patient's capacity to understand the messages you're giving through normally the level of health literacy is very important. There are in the literature, more sophisticated approaches where you can have contracts with patients, but there's limited evidence in terms of their effect. And it's really important that you assist the patient in their decision-making processes. So it's not about telling the patient what to do, but providing them options so that they can make a decision and they're empowered to make that decision. From the pharmacist's point of view, what we're seeing now is a whole range of scope of practice developments. And with that, those scope of practice developments, you'll see that there are clinical protocols and guidelines. And if you're part of developing them or applying them, please think about how you can include self-care within those scopes of practice, particularly in terms of picking up red flags where your advice to the patient must be at a different level because they need to be referred to a higher level of care. So in conclusion, first of all, what we need to do is to clarify all these differences between self-care, self-management, consumer empowerment, plus the list that Austin's given you. There's very little clarity in people's mind. At the moment, what we're seeing is that although universities are involved in developing self-care within different courses, we're not seeing the development of specific self-care courses, which include theories, model frameworks, and more importantly, provide evidence-based interventions. And from a community pharmacy perspective, we need to shift the thinking from self-care just being part of what's thought about OTC or non-prescription medication or minor ailments. It's a much broader professional practice, which even if you want to use a very simple model, you can use the model that we suggested. And finally, to try and mold community pharmacy minds about this, we need to look at the professional organizations and try to identify whether pharmacy has a very broad role across the 7 pillars, or whether we've become much more specific and focused on 1 or 2 of the pillars. Thank you very much, and I look forward to your questions.
Thank you so much, Charlie, for your in-depth analysis and for sharing all your expertise. We'll come back to you when you have the the roundtable discussion. And I'll move forward with next presenter, Jurate Svarkeit she's the Director General of AESGP. It's a long acronym from the European Self-Care Industry Association, which is based in Belgium. Thank you so much for taking the time. Jurate, she's a fellow pharmacist as well. So very happy to have you on board on this session. So the floor is yours. Thank you.
Thank you, Luis, for introducing me. It's going to be hard to follow on the two distinguished speakers before me. Let me start by saying happy Self-Care Day to you all. I hope throughout the day you will practice self-care, whatever it is for you. We already discussed definitions that there exist regarding self-care. In a simple way, I define self-care actually as something that you do for yourself or for your family to stay healthy or to improve your well-being. And ASGP, and I'm trying to make the slides work, ASGP stands for the European Self-Care Industry Association. And by self-care, in this case, we mean, because as already Austin has explained to us, self-care continuum is really, really broad. Our focus of our industry is really self-care that you practice by using our products. And by our products, we mean non-prescription medicines, food supplements, as well as some of the medical devices that you would find in the pharmacy, which ranges from plasters to eye drops or, for example, condoms, so that are very important as well. We are united under one mission in the association, which is support everyone's access to safe, effective, and increasingly sustainable self-care. And there are several dimensions that I will talk about in terms of sustainability in this meaning, as well as empowering people, because I do strongly believe that people that are empowered to take care of themselves and their families are more likely to stay healthy and avoid needing professional care. So let me talk to you, building on the previous presentations, about actually the economics of the self-care, and in particular the economics of self-care that are that are generated by practicing self-care by taking some of our products, and mainly non-prescription medicines. So if you look at the sort of a need for healthcare and self-care, I would tend to argue that self-care needs are the highest, then sort of primary care, and then the secondary or tertiary care, as already explained by a self-care continuum, is the care which is the most expensive and, let's say, least needed, unless you are not practicing self-care and ending up in the GP's office or, for example, emergency department when you don't really need. If you think about today's challenges in terms of healthcare systems, but generally economies, we know our population is aging. We know that new innovative therapies are coming on the marketplace. They tend to be quite expensive. Some of them are one-off, meaning you get one injection and you are cured for life. And this is all increasing the need for more resources, and especially financial resources, but as well as healthcare professionals' time. We are still on the backlog of the COVID pandemic in terms of accessing doctors. We know that the lines or waiting times to see a specialist in many countries are extremely long, and it's really an effect of 2 years that we were closed down, of course, except of the pharmacies, but it was not possible to see to have a face-to-face consultation or intervention by your doctor. So we are still riding on this wave of backlog of the healthcare appointments, and I don't think that in any short time this is going to get any better. We also know that retention of healthcare professionals is a big problem. We know that a major part of healthcare workforce is going to retire. So therefore, we will continue to have more problems in how we can actually sustain and make sure that people that really need can access that so important secondary or tertiary care, or even the primary care. And my suggestion here, and this is also the basis of my talk, is to argue that more self-care means more healthcare. And I want to pick up on the question that I saw already in the chat. How does it correlate with the universal healthcare coverage? If a country wants to provide universal healthcare coverage for its citizens, it cannot do it without the self-care, without the significant contribution of self-care. What does it mean? That you need to have a part of your population, or maybe every citizen, practicing self-care in order to maintain and be able to provide the healthcare to those that are really needing it. Why pharmacy is so extremely important in terms of self-care and in this self-care continuum and in this self-care pyramid. I'm sharing you the results of the survey, which we have done very recently on researching something else. And it just shows, and this is a European figures, it shows that actually pharmacy is the most close, and as Charlie also already alluded to, it's the center of community. So I think the benefit of the pharmacist has always been that you are in the center of community with the proximity and with availability to your patients, but as well as just people that are seeking to improve their health, or they are trying to actually get better because they have been diagnosed with something, or they are planning to just improve their well-being today. So you can see that based on these figures, really a majority of the European population will have their pharmacy in very close proximity, either to their work or to their place of living. And this is a very important asset that you have in your hands in making sure that actually self-care is practiced responsibly and also sustainably, which is also extremely important. So talking about self-care, and again, I'm not talking about broad continuum of self-care, I'm really focusing on self-care that you practice when you have a minor ailment and you have a possibility to self-diagnose and also self-manage. Typically, you will resort either to seeing a doctor, going to a pharmacy, and sometimes you will wait and see whether your condition is going to improve, or you are going to maybe get worse and will have to reconsider going to see a GP or going to see a pharmacist. Obviously, the idea of consulting a general practice doctor when you have access to a broad range of OTC medication does not make much sense, especially from the sustainability point of view. So if you think about sort of your healthcare journey, or if you think about your footprint in the healthcare system, I think the future idea of health policy will be in seeing how to reduce this footprint. So first of all, in order to ensure that you have more GP time for serious cases, but also if you think about a new, or let's say an existing concern about the climate change, actually every visit to the GP, which means normally that either you drive a car or you take a public transport, you miss on work, you are going to be in the waiting room, then you still have to go to the pharmacy in the end. This also speaks about sustainability in the sense that you not only exhaust the health system resources, but you possibly also increasing your CO2 emissions, which is a new lens that we are also trying to look at, because we all have a challenge of changing climate, and I'm sure those of you that are living in the southern countries are suffering from yet another record heat waves that are hitting us every summer. So here I want to share with you some of the latest figures that we have generated, which compares, and sorry, these figures are coming only from Europe, but we have done a similar study with GSEF, who is our global association representing the global self-care industry, where we compare the cost of self-care or otherwise going to a pharmacy versus going to see a GP. And you see that depending on the country, of course, your savings that you generate as a pharmacist to healthcare system ranges from 11 euros. And in some of the countries where obviously the health costs are more expensive, it will be up to 41 euros. That every time you consult someone with minor ailment in the pharmacy, this is how much you are going to save to the health system in terms of actually GP visit, but as well as costs related to most likely prescribed medication or any other sort of things that might be recommended at the doctor's office. So I just want to tell you, every time you support your patient in their self-care journey, this is actually directly saving the money and making sure that those significant resources are allocated in the right place. If we add this all up and we calculated, and this is a very conservative calculation, that in Europe alone, we are actually in pharmacies managing 1.1 billion minor ailments a year. And this generates 36 billion of resources in terms of euros that you actually are allocating to other things. Otherwise, if you imagine that no non-prescription medicines were existing today, would be the money that you would need in addition to care for those people that would be coming up to the GP to get a prescription. So I really encourage you to consider that every advice you give, every recommendation you make to your patients actually is directly contributing to sustainability of healthcare systems. Can we do more? This is my question. And it's a very important question, knowing that we are celebrating self-care day today. And the answer is obviously, yes, we can. We have calculated, again, a very conservative estimation that around 50% more we could save together by making sure that people that are confronted with minor ailments choose self-care first, and do not go and see their general practice doctor, or even worse, end up in the emergency departments. If we translate these numbers also further in sort of what does it mean for health systems, because I'm sure that when you talk to the politicians, 36 billion euros is a lot, but not everyone can understand numbers. We also have translated this figure into human resources. So if no non-prescription medicines existed in Europe, this would mean that we would need 120,000 more GPs working, or otherwise every GP which is today working would have to work 2.4 hours more every day. So you can imagine that you are releasing the pressure of your general practice colleagues every day, and you save them at least 2 hours of their time, either to do something more important or just enjoy life. And as well, a person that chooses to see a pharmacist rather than going to the GP has a considerable savings of their own time, because otherwise they would have to wait. I mean, I don't know what about you, but normally when I go to see a GP, I never have my appointment on time. And this means that I'm spending my precious time sitting in their waiting room. How can we do more? So there are two directions of travel. So first of all, how can we encourage more people to think pharmacy first? And choose a consultation with a pharmacist over seeking GP care. And on the other hand, we see a huge discrepancies in terms of availability of non-prescription medicines from country to country. And I'm going to share with you some data very shortly. We have also looked at the assessment of the uptake of self-care in Europe, and you see this small map, and my slides will be made available after this presentation. You see a map with intensity of green increases the uptake of self-care. So the self-care champions would be UK, would be Germany. Poland is one of those countries that are practicing quite intensively self-care. And you see the other countries that are still way behind. So why I'm saying this is that in those countries which are lighter green, the potential of doing more self-care and generating more savings for health systems and releasing the pressure of GPs is greater, obviously, than in the countries of the dark green. I encourage you to visit an ASGP ingredient database, which is available free of charge for everyone. We have just recently updated this database. You have basically a list of 200, I believe 60 something molecules that are available OTC in the entire Europe. Unfortunately, there's no one country which has them all. And it lists the status of the molecules as well as different indications that you can enjoy, as well as different pharmaceutical forms. And this is a resource which is extensively used by regulators as well, because this is the most comprehensive there is. Why I'm sharing this, you can see for yourself in this graph that we are talking about Croatia, which today has 55 APIs available as an OTC, in comparison to United Kingdom, which today has 145. I would argue that I don't think there is a big difference between Croatian people and British people in the terms of being able to practice self-care. However, we are today witnessing a situation where access to self-care is defined by the country you live in, and there are huge discrepancies in terms of availability of the products in your pharmacies, which enable you to actually advise your patients and help them on the spot rightly there, and avoid them going and seeking the healthcare provided by your colleagues of general practice. If we practice more self-care, and the potential, as I said, depends on how many molecules you have on your market and what's the prevalence of self-care, we could together release another 58,000 GPs, or otherwise every GP today could finish their work 1 hour earlier. I think this is an extremely important figure to keep in mind, knowing the challenges of the retention of the general practice doctors, but as well as recruitment of new general practice doctors going into the future. So more self-care is definitely a good thing and the right thing to do. So I do not have a silver bullet in how we can make sure we have more self-care. There are different building blocks, such as, for example, economic situation, healthcare system design, cultural framework. Being a pharmacist, I can openly say I have never heard a doctor which supports a switch from the RX medication to OTC, because they all are fearing that they will not have enough of patients coming into their offices. They will threaten you by the fact that people will be misdiagnosed and have their problems aggravating. And I think this all is a little bit of a nonsense looking at the discrepancies between the countries, because I would argue that someone that can do it in the UK definitely could do it in Croatia as well. So that's all from me. All of the information which I have shared, I encourage you to visit our website, asgp.eu. You can find the study there. 200 pages is a lot to read, but there are a lot of interesting facts about pharmacy, because obviously, as a self-care industry, we do believe that pharmacists are our partners in self-care, and there's no self-care without the pharmacy. We strongly believe that we need to work together. And all of those resources that I have quoted are freely available to you. And we hope that we can rely on you for making sure that we all collectively practice more self-care and that our health systems remain sustainable and open and available to all of those that need those. Thank you. Over to you, Luis.
Thank you so much, Jurati, for sharing information, for covering as well some of the questions that were put on the question box, and also for the availability to share your slides with all the participants. Thank you so much. We'll come back to you when you go to the session panel, and then we'll move forward to our next presenter, who's actually going through some technical issues, but we'll try to sort that out. So I'm very happy to introduce you Busy Bright. She's a consultant clinical pharmacist, which is also a board member of the International Alliance of Patients Organization. So Busy, the floor is yours. Thank you.
Thank you. Good morning, good afternoon, good evening, everyone, wherever you are. It's a privilege to be here, and I want to say a big thank you to the FIP for this opportunity to talk about health literacy as a tool for advancing self-care. Well, I'll start by defining what health literacy is, and I like to go by the global definition, which is what the WHO says health literacy is. So the WHO defines health literacy as, the personal characteristics and social resources needed for individuals and communities to access, understand, appraise, and use information and services to make decisions about health. So that is the global definition of health literacy. So we see that the decisions, the health-making decisions, are really influenced by how literate we are. And I'll go further to expatiate on what health literacy is. So the next slide tells us that health literacy is actually the ability to gain knowledge and insights into healthcare and health-related matters with a view to improving healthcare outcomes. So it could be my level of health literacy, your level of health literacy, impacting the outcomes of healthcare, either as related to me or to my neighbor, my relative, or whatever. And it is hardly related to functional literacy. I would share with us, for example, that I have seen the case of a dermatologist. So you would know that for him to be a dermatologist, he was a specialist, a medical specialist, yet that person ended up with glaucoma that led to the loss of his eyesight, not because he was a functionally illiterate person, but because his health literacy level as related to glaucoma was so low, yet he was so advanced in dermatology. So it has little or nothing to do with functional literacy, and you can find people who are low literacy persons being functionally health literate. So health literacy requires knowledge and knowledge management, and it also goes a long way in determining healthcare outcomes, like I said much earlier on. So talking of self-care and how it affects health literacy, self-care. Now, you find out that self-care is the care given in the absence of a trained caregiver. So it is a skill which can be learned or acquired. And like I said much earlier on, it has little or nothing to do with our level of functional literacy. So a low literacy person can administer self-care if they are health literate enough to do so. And self-care actually requires health literacy, like I said, and a lot of knowledge. And it helps to minimize the unmet needs of patients. You find that patients, everybody everywhere in the world has either been or will be or is a patient. So you find out that at that time that person is a patient, there are many unmet needs that patients have. So many unmet needs of patients. So when we look at the unmet needs of patients, it seems I was thrown out of the meeting temporarily. Kindly let me know. Hello, can you hear me?
Can you repeat,
Can you
please?
hear me,
Sorry.
please?
Can you repeat your question?
Yes.
Yes, we can hear
wondering.
you.
It
Yeah, we
seems
can
I
hear
was
you.
thrown out of the meeting
No,
temporarily.
no. We are hearing you perfectly. Thank you. So please go ahead. No worries at all.
Okay, thank you. Yes, so I was already talking about self-care, but I think I was thrown out at the time. So talking about health literacy and self-care, you find that with health literacy, you will be able to administer a lot of self-care. And without health literacy, you cannot administer self-care. So self-care is the care given in the absence of a trained caregiver, like I said. Can I have the slide on self-care? The slide on self-care, please. Please kindly transition to that. Yes. So, and self-care is actually given by a trained caregiver, and it's a skill which can be learned or acquired. In the absence of a caregiver, you can also have self-care when a health literate person is on hand to give that care. And that health literate person may even be a functionally illiterate person who has learned to give self-care, may just have done that. So we require health literacy and knowledge management to be able to give self-care. And self-care, I was talking about the point at which I realized I had been thrown out of the meeting was when I was talking about self-care and patients' unmet needs. And I mentioned the fact that everybody at some time in their life has either been or will be or has been a patient. And patients always have unmet needs. So when you give self-care, you meet some of the unmet needs of the patient, and then you minimize patients' unmet needs. So who can give self-care? Who can really administer self-care? Next slide, please. Who can give self-care? So really, anyone at all who is trained in meeting the patient's unmet needs can give self-care. Anyone who is trained in meeting unmet needs. And it should be limited to patients' unmet needs, because the trained healthcare worker or healthcare professional or carer will provide care regularly. However, there are a lot of unmet needs, sometimes due to subjective symptoms that the patient feels, and these, because they're subjective, have not really been fully measured. The patient presents at the pharmacy and they forgot to mention this at the physicians, or it's just a symptom that the patient feels and cannot really identify what the cause is. Those are unmet needs where when they come to you as a pharmacist, you can listen in and find out where you can meet those needs. So in resource-limited settings, self-care is definitely inevitable, and the pharmacist plays a very key role, especially in resource-limited settings like ours. So you have to try to reach out to meet those unmet needs. Now, health literacy is also a very that we do this by providing a basic amount of information that the patient needs, and then you empower the client or patient the difference.
Sorry, I think we have some technical issues with Busy. We'll try to work them out. And for the sake of time, I'm not sure. I might just kindly ask you just to hold 30 seconds while I check with our staff if Busy can join in.
Yes, Busy is already there again.
Yeah.
Busy, you are muted. Perhaps you can open your mic.
Perfect. Yeah, you're muted, Busy. You're muted. Yeah, still.
I'm really sorry about
Oh,
the
no worries, no
internet.
worries. Yeah.
I'm sorry.
So, yeah, thank you so much, and we're
Really
really
sorry.
enjoying. Yeah, no worries, BC. Well, we're really enjoying your presentation. Just
Can I continue, please?
yeah, sure. Just to let you know that we have roughly 7 more minutes for your presentation. So sorry for that. There's a lot of content in this webinar, but please, the floor is yours. Thank you. You can go ahead. BZ, are you there?
Okay, just a few more. Okay, I'll race through, and let me just try and race towards rounding up, and you can share the presentation. I apologize for all the challenges, the network, and the interruptions.
Yeah.
I'm really sorry about that.
But we are pharmacists, so are used to challenges, so no problem.
Yeah. Thank you for your kind understanding. Thank you. Yeah, so I have what I call my health literacy toolkit, which every healthcare practitioner should have and use, administer to their patients. So it has to do with basically sleep, the DASH diet, exercise, and lifestyle modification. Have all those four, and your patient sees them as their health literacy toolkit. Your patients will definitely do much better. So sleep is therapeutic, and you make sure that the patient knows that he needs 6 to 9 hours in every 24 hours, 6 to 9 hours of sleep, so that he can enjoy at least 2 cycles of REM sleep every time he sleeps in the night. And your patient has to work that out. The DASH diet, which has nothing to do with hypertensive patients alone, but for everybody, it's a global diet for everybody. Dietary approaches to stopping hypertension, but the DASH diet is the ideal, adequate diet for everybody here on Earth. And then exercise, 30 minutes of basic aerobic exercise 3 times a week would be enough for most people to maintain good health. And lifestyle modification, moving away from the sedentary lifestyle and to a more active lifestyle, smoking cessation and a lot of other things. So each of us should make sure that we adopt the what I call my health literacy toolkit. Adopt my health literacy toolkit for your clients and make sure that each of them customizes it to their own needs. That way you'll be able to cover stress management. They wake up in the morning with a colorful table telling them what they need to do, what their self-care process would be, and what they would need for self-care. And part of my health literacy toolkit includes supplements and so on, self-testing, self-monitoring. The major difference between self-testing and self-monitoring is the self-testing kits are the rapid diagnostic test kits, and then the self-monitoring kits are the blood pressure kits, the sugar kits, and so on. And it has nothing to do, like I said, with functional literacy. A low literacy person can have a self-monitoring test kit, and can have a functionally literate person who can come in and get all their records for them. I will race down to the slide with the pregnant women who are being tested for hepatitis. Like I said, I don't have much time, so I've raced through. I've tried to cover all those things, and I'm now on slide 18. Health literacy, as a tool for creating what we call the activated patients. We as healthcare practitioners should make sure that our patients are activated. So once your patient has his or her health literacy toolkit, that patient is already an activated patient, and you are becoming a patient expert without knowing it. So look at those pregnant women. They are activated patients. How did we create activated patients? These are very low literacy patients, as you can see them. But we've made them understand the importance of getting tested for hepatitis when they're pregnant. And the simple way in which we got this across to them is, have you ever seen a bad liver being sold in the market? You know how ugly and hard it looks and discolored with patches all over? You don't want your baby to be born with such a liver. So make sure that you come, get screened, encourage other pregnant women to get screened. And if you do test positive, make sure you come for your medicines so that your baby does not get that disease. And when your baby is born, you will get your full medication and everybody will be happy. So that's health literacy. Creating activated patients, that's one of the outcomes of health literacy as a toolkit for self-care. And then I've talked about self-testing, which is the use of rapid diagnostic test kits, which actually gives a lot of people privacy. They like the privacy it gives, and the outcome is usually less mortality, less morbidity, and then we end up with everybody being happy. Another good area where we come in as pharmacists is enhancing family planning through health literacy and community participation. We've had something very, very interesting we did here at the Live Well initiative with Harvard University, and we brought in the community to sit down and talk about family planning. We had focus group discussions between the men, the men and the men, just talking about family planning. We also had the elderly women in the community who are the mothers-in-law, talking about family planning. And then we brought in some young girls who are adolescents in the presence of their guardians or parents to talk about this, with the permission of their parents, of course, but the parents were just observers. And we got quite a lot of data out of that. So it has helped to enhance family planning. The mothers-in-law who was totally against it, thinking that it leads to promiscuity, they could now see the value in family planning. And everybody became more health literate on the family planning matter. So every aspect is very important. Let's look at metered dose inhalers. People don't know, they think the higher the dose they use, they end up being hyperventilated if they take too much. So you teach the client how to use it, let them come in and use it, let the parent learn it, and then teach the child, or you teach the child in the presence of the parent, and they understand the aura, and so you can prevent frequent exacerbations of the airway.
Sorry, Busy, just to inform you, have 1.5 minutes, if that's okay.
Okay, thank you.
I'm very sorry. Thank you. Thank you.
Now. Yes, thank you. And then, yes, thank you. So the metered dose inhaler, very important. And then we look at things like directly observed therapy in chronic disease, chronic infectious diseases like tuberculosis, where you need directly observed therapy. Health literacy goes a long way, because once that person understands that if they're not taking their medication, there will be recrudescence, and this can lead to morbidity and, in fact, mortality, they will be more compliant. Then infection prevention and control, simple things like just teaching people to sneeze into their clothing, sneeze or cough into your clothing, or wear a mask if you need to. These are all very important. And then we talk of responsible self-medication. I'll jump quickly to that. Responsible self-medication and prophylactic therapy. The World Health Organization, in its revised drug strategy, encourages responsible self-medication with the assistance of a trained healthcare professional, and that's a key role for us pharmacists, where you have the revised drug strategy of the WHO, talking of rational drug use and so on. And we as pharmacists can help people to self-medicate responsibly, especially with nutraceuticals and so on. And I end up with this picture showing that with health literacy, we can also achieve universal health coverage. And you can see the children in this picture holding the UHC flag. So with health literacy, even a child can become health literate. You encourage the children to know that they too play a role in their own healthcare. If you play with sand, wash your hands before you eat and so on. So I quickly conclude by saying that self-care will be impossible without health literacy, which is very powerful. It's a very powerful tool for the implementation of self-care. And self-care is appropriate when delivered with health literacy and in an appropriate format, which now helps with the informed decision-making, and that improves outcomes of therapy. Without health literacy, self-care will be very, very unimpactful. However, self-care does not and cannot replace medical care. So thank you all for listening, and once more I apologize for all the interruptions. Thank you, FIP, for the privilege. Thank you all.
Thank you so much, BZ, for your time, for sharing your expertise, your practical approach. It's actually, it suits very well on the previous presentation. I'm sure it also will suit with our last presenter, our last speaker. So I'll not just will give you a short presentation from our last, but definitely not the least speaker, Kai-Zen Yap. She's a lecturer from National University of Singapore, Department of Pharmacy and Pharmaceutical Sciences. It's an honor to have you again with us, Kai. So please go ahead. The floor is yours. Thank you.
Thank you so much for the introduction, Louis, and for the invitation to be here today. It's always exciting to hear from all over the world what are some of the global movements, initiatives, challenges, and hopefully at the end there will also be some time of interaction where I'll be most happy to hear of course, the participants as well through the question and answers of how we can definitely think about self-care. So I'll just like to begin by saying that for my presentation, it's really a sharing of the experiences and the reflection of what's happening in pharmacy education, and from the conversations that has been had with students who are pharmacists to be, and of course fellow pharmacists with regards to challenges and implementation, and what we can all think about as pharmacists when it comes to thinking about self-care and providing it as part of care for our patients. First up, so I began by asking Google what is the definition, and this is what was churned out. So we can see that it basically emphasizes on the action that the patient takes for health. And then I moved on to look at what WHO says. And from the WHO definition, it basically also extends this to include actions not only by the patient, but also to involve other individuals, such as those in the immediate and the extended environment of the individuals, for example, family and the community. And BC, the previous presenter, has given some great examples of how this has happened within families, within communities, in order to take action towards better health. And the other aspect of this is really the wide opportunities of where health, self-care can happen. And as shared by Austin with the continuum of self-care and the 7 pillars, really there are many opportunities where pharmacists can definitely play a role to promote self-care in a holistic manner. And and another example of how we really need to involve the immediate and the extended environment and everyone, and not just the individual patient who comes to the pharmacy and meet us, is the example that's fresh on everyone's mind, and that is the importance of really talking about preventive health. And what has just happened was really in preventing the spread of COVID, self-management of symptoms at home, etc. And therefore, the focus on self-care to me is really about patient empowerment and getting help with healthcare providers in various varying degrees, depending on the situation and the opportunity that we're looking at in terms of providing self-care in order to meet the individual patient's needs. So I think for the reflection here, I really emphasize on the word care. And in this sense, if we are at the pharmacy as a provider, and when patients come to us, it is so true that individual coaching definitely has a great role in terms of helping the patients to really know exactly what to do and how to conduct care for themselves in order to achieve health. However, having the know-how does not necessarily translate into effective and safe actions taken by the patients at home. And I was just using generative AI to generate some images of this quote here, that each patient carries his own doctor. And when they come to us not knowing the truth, we are at our best when we give directions and instructions so that they can carry out the best actions in order to get back to health after they leave the pharmacy or when they get home. So as the pictures allude to, sometimes, like for example, the one in the center picture, it can be relating to a caregiver, or sometimes the patients don't come to us at all for help. And therefore, I think with regards to thinking about what the individual pharmacist can do, it is really about patient empowerment. And it is also about thinking about how we can achieve patient activation, which is essentially thinking about interventions to address the underlying mechanisms to nudge patients' behavior and actions, in addition to just providing the advice that we can give to patients. But coming back to therefore the thinking about how do we then promote a holistic approach through pharmacy. I think the basis to begin with is to look at the opportunities that we have at the pharmacy, at the counter. And of course, what is the simplest thing to do is to think about starting conversations towards appropriate self-care. And there are many opportunities, and it doesn't only restrict to talking about symptoms, managing minor ailments, or the use of OTC medications, because self-care, if we think about it as behavior of the patient, it also translates into management of chronic medications, for example, in how we manage chronic conditions. So adherence comes to the forefront with regards to appropriate self-care in that aspects. It's also about appropriate monitoring for side effects and for efficacy and safety of chronic disease and medications used for chronic disease management. Definitely also about addressing appropriate lifestyle modifications and change as part of non-pharmaceutical interventions to support management of diseases. And it's also definitely about preventing illnesses. It's also about health screening, about thinking about vaccinations, and of course, thinking about risk factor modifications. And one of the huge examples that comes to mind in terms of risk factor modifications is in smoking cessation interventions and programs that pharmacists can provide definitely to patients as part of the consultation and advice. And I just want to use this opportunity to then think about what is that holistic approach and what is the roles and responsibilities of the pharmacist. And with regards to what we do, I think no matter what the activity is, whether it's advising on OTC or product use, or it's advising on responding to symptoms that the patient comes to us, or whether it is talking about dispensing of chronic medications, how do patients manage their very complex medication regimens at home, I think it all boils down to the professional identity and, of course, a common philosophy, standard care process of what we call pharmaceutical care, which basically is the essential core activity that defines everyone as the pharmacist. So I think in terms of providing the care, other than conducting patient interviews, history taking, assessing and accurately identifying the problems or providing effective and safe advice on medication use for treatment, non-pharmacological advice. I think the other important aspect that is often missed out, especially in community pharmacy, is that of the follow-up, especially for minor ailments, which sometimes it can be important because for minor ailments, it's not always episodic or just a one-off. There can be a opportunity for chronic or long-term follow-up, for example, like allergic rhinitis or reflux issues or migraines, where there could be recurrences of the symptoms. And therefore, it's a great opportunity when we think about holistic care provided to the patients. Maybe we can also start to think about how we can actively follow up with the patient in order to make sure that the self-care that they are doing at home is effective and safe. And the other aspect about thinking about this pharmaceutical care philosophy is also relating to our role as a pharmacist in really identifying and resolving medication use-related issues. And therefore, by following up with patients, definitely gave us an opportunity to assess whether or not there are outstanding medication use problems at home and to address this in a timely manner. There's also opportunities to look at how patients manage minor ailment symptoms and see and check for red flags, as pointed out by Charlie, and provide timely advice for the next steps and maybe even referral to a healthcare provider. So I think with this regards, it is definitely important to recognize that self-care is definitely something that all healthcare providers should really focus on. And it is a case where there definitely needs to be a partnership with the healthcare provider in order to ensure that there is good clinical advice and clinical appropriateness with regards to the self-care that the patients are doing at home. The other aspect that I wish to highlight in terms of thinking about really what we do on a daily basis, whether it's OTC or dispensing or just dishing out advice to the patient and aligning it with the pharmaceutical care, is that of the last part, that in so doing, the philosophy of pharmaceutical care basically says that we do this in a patient-centered manner. And essentially, paraphrasing it, it means to support the patients in order for them to continue to live and function, and which is what matters most to the patient. And I think in thinking about this, it's definitely important to bear in mind that, when advice is given, well, most of the time, because patients come to us at the counter, they're actively seeking advice, they're motivated. But there are also some patients that they already know what they want, and maybe they do not wish to spend more time going into history taking or to discuss more about the other related non-pharmacological lifestyle modifications and things like that. So the idea is that sometimes while we can give clinically good advice, it may not always be accepted or acted upon by the patients. And that draws to the importance underlying idea that in self-care, we're really talking about behaviors of patients. And when we talk about behaviors of patients, we need to also be cognizant about what motivates patient, what patients want out of that consultation, and whether or not the advice, which is clinically appropriate, is actually accessible and feasible for the patient to carry out at home. And lastly, is it acceptable by the patients, and whether it sits within the patient's cultural practices, values, and even the belief system to have confidence in the advice and to carry it through. So really, again, it's the idea about how do we then rethink this whole self-care advice in a holistic manner in order to really translate patient empowerment, as in the giving of advice, into patient activation in how they actually care or conduct the activities of self-care at home. So I would like to highlight three ideas for consideration. The first is of integrating really the health psychology in order to allow us as clinicians to assess, identify, and address factors relating to health, illness, and healing. So I think it's increasingly important in health education now to include a module or courses in health psychology, because from using some examples from biopsychosocial model, it actually teaches us that what leads to illness is not just the biological makeup or the mechanism of pathophysiology and so on and so forth, but actually the psychological and social factors may also contribute to illness, and which should be addressed if we're thinking about holistic self-care advice in order to bring patients back to health. The other learning from biopsychosocial model is that illness itself may impact on the psychological, social, and maybe spiritual aspects that may be a need to be addressed as part of that holistic healthcare that pharmacists can really help to advise patients on. The other example of health psychology that really can be integrated in how we respond and communicate or interact with patients is that of the ecology model. Indeed, I think it's important to recognize that sometimes patients' problems can be really complex because they can be having low socioeconomic status, they could be financially strapped, they could be also concurrently having psychological or social needs and requiring support. And therefore, to really start thinking about advice and interventions at more than one relevant levels, not just relating to the patients here and now, maybe also start to think about collaborating with other healthcare providers, such as social workers, maybe referring to GPs, maybe referring to community nurses, or even coming together to form larger collaborations in providing national initiatives. And like what BC said, really thinking about it from a community level in order to resolve some of the very prevalent issues that we see in the community. The other health psychology that is commonly mentioned and talked about in health education to pharmacy undergraduates is really that about thinking about health beliefs model to really be able to start considering what are the motivations and barriers to behavioral change, and then to use some of the other behavioral change models such as trans-theoretical model of change and motivational interviewing in order to be more effective in our communications, to provide nudges along the way, to translate our advice, to ensure that patient carries them and be activated to participate in self-care at home. So that's the first thing. The second thing is for the practitioners on the ground to really start thinking about narrative competence. And this is the second thing that is really exciting that we're really introducing into pharmacy education to our undergraduate and future pharmacists. And the integration of narrative competence basically helps to strengthen the therapeutic relationship. It strengthens patient engagement and therefore contributes to patient activation. And I think how we can think about this is in the form of acknowledging patient's presence with us to be able to then not only just participate in active listening and empathic responding, but it's really to activate the knowledge on health psychology, and as we listen to patients' stories and narratives, to actively be sensitive to the meaning and the context and perspective of what patients is telling us. And by that, we can then be more attuned to pick out nuances that patients' stories refer to in the form of motivation or barriers, and then to then apply nudges with the use of communication frameworks in order to help push patients' motivation to the next level towards changing behavior. I think one example that I remember vividly from a conversation with a student when they go out for attachments with pharmacists is that they have observed a smoking cessation counseling communication. So the pharmacist was talking to the patient, and patient was talking about wanting to quit smoking during Ramadan. And however, to the student who is observing Ramadan, they see it as an opportunity for the pharmacist to tap on to actively promote smoking cessation, but the pharmacist did not see it. So again, it is really interlinked and interlaced with the ideas of cultural competency, narrative competence, to really be open-minded and sensitive in order for us to really engage patients more actively in how we provide the care and how we interact with patients in order to promote self-care in a more holistic manner.
Sorry, Kai, can you, sorry for that. Well, we have 1.5 minutes, 2 minutes maximum. Will that be okay?
Yes.
Thank you so much. Thank you so much.
Yeah, thank you. And the third thing and the last thing really to think about is on integrating health literacy principles and strategies, which BC has highlighted. And I will leave everyone with this slide that you might look at some tips on how we can incorporate health literacy principles in promoting holistic self-care from the pharmacy. Advance the slides. Last but not least, as mentioned earlier, self-care sometimes can be very straightforward, but at other times it can be really complex when we really want to look at the patients in a holistic manner, including the bio, psychosocial, and maybe sometimes even spiritual. So having this idea of a teamwork in the care is really, really important. And I think for the pharmacists practicing at the pharmacy counter is really to know our scope of practice and limitations, to recognize when formal help is needed, and therefore to actively refer to the appropriate healthcare professionals in order to cite patients so that they can really receive the appropriate advice and care and in how they can continue with their journey of healing at home. And I've come to my last slide is really about also thinking, what about those patients who are not with us at the pharmacy counter? I think it's important to really also explore the use of mobile apps and other technology in order to have a wider reach to everyone and to improve on health equity in relating to self-care and ensuring that everyone has effective and safe actions at home back to healing. It's also about pharmacists participating in public health education initiatives. It's really also maybe thinking about voluntary work or really tapping into resources to see how we can outreach to those who are underserved, vulnerable individuals who are actually not reaching out or not accessible to pharmacy or to pharmacist advice or to any healthcare provider advice. And with that, thank you very much for the opportunity to share. I'm happy to share my slides and open the time to Q&A. Thank you so much, Louise.
Thank you so much, Kai. As usual, very informative. And also thank you for your availability to share your slides and your expertise to everyone. So I'll just quickly just give the floor to Mufon just to share some information on FIP, and then I'll come back. Would that be okay, Mufon? I'm not sure if she's hearing me. So anyway, just for the sake of time, I'll just have a quick wrap up. So at the beginning of the webinar, I had a chance to share with you that we had an amazing panel of specialists in self-care. And by now, you know that I was totally right. So I just kindly ask for all the speakers just to switch on their camera and to join me at this moment. Thank you so much. So thank you for your enthusiasm and also for your in-depth approach of your presentations. I think all the participants, roughly we have 150 participants just attending. Thank you very much for sharing that. And also to go through the questions on the Q&A box. And some of them have already been covered by the speakers. So in due respect of everyone's time, as you know, we are very short on time because there's so much to share and there's never enough time just to go through all of it. I will just, since it's not possible just to go to have a discussion, I'll just kindly ask for all the speakers, and I probably will just follow the order of the presentations. So I'll ask the speakers just to cover an idea or in a sentence, what would you like for our participants to take home from all your presentation and from all this webinar. So I'll start with Oster. Thank you.
Thank you, Louis. Thank you, everyone. Great presentations. I learned a lot as well. I think the take-home message is, conceptualizing self-care, working with the pillars to remind people that they have a lot of power in becoming expert self-carers. And this is something that can be done slowly but surely, ideally starting from a young age. And finally, the role of the pharmacists is fundamental here. Self-care navigators, you have a very important role to play. Good luck, and I hope to reconnect again in the future. Thank you.
Likewise, on empowerment, very strong words. So Yurati, your turn.
Unmuting myself is self-care. So thanks a lot for this webinar. First of all, I wish you again a very nice self-care day. Practice self-care yourself as a pharmacist. I think it's very important first to take care of yourself, and then you can take care of your communities you serve. And definitely you are the partners in self-care for so many citizens that visit you every day. So thank you for your service and happy self-care day.
Thank you, Rati. Charlie.
Look, my take home message is that if you're a practitioner facing patients every day, is that so you need to think about when you're dealing with a prescription of or an OTC to empower your patient and talk to them about self-care, because it's something that will get you much better clinical outcomes than just about talking about the medications themselves.
Thank you
And
so
thank
much.
you for being part of the group.
Thank you so much, Charlie. Our pleasure. Busy.
Thank you very much. I want to thank Luis and the team, and I want to thank all the speakers. Very, very enlightening facts and very interesting points that were put out there today. And happy Self-Care Day to us all. And to all the listeners, I'll say please encourage your clients, your patients to have their health literacy toolkits, which is the knowledge kits with which they will deliver self-care, or they will also use the same toolkit to supervise self-care when it is being delivered to them by a non-trained healthcare practitioner, like in an emergency or whatever. So have your health literacy toolkit handy, and you'll be the best self-care provider. Thank you.
Thank you so much, Busy. Homework for everyone. Kai.
Thanks, Louis and team, and thanks everyone. Really learned a lot from all the speakers here, and thank you for being with us, and to all the participants. I just wish to highlight and shout out that you are all doing a great job by being pharmacists first and foremost, and in really being interested to care for the patients and what the patients do at home. Essentially, at the end of the day, it's really about transforming lives. And it's not just about the medications, but it's really about the patients at heart. So doing a great job, and happy Self-Care Day.
Thank you so much, Kai. That's a good way to actually wrap up. I'll just give you an information. So as you know, FIP is launching and preparing a lot of materials regarding different subjects. And of course, self-care is a focus, especially now during this special day. So I'd like to inform you that FIP will launch today a new series of continuing professional development bites, the CPD bites. So be aware on our communication tools and our social media accounts as well. So just would like to emphasize you that if you have any ideas or any thoughts, please share with us at webinars@fip.org. Again, thank you so much for all the participants for being here. Thank you so much for our presenters as well for your time and for your expertise and for your availability to share all of this. I hope that in the future we'll be able to work again for not only for self-care but other issues as well. Thank you so much. Have a good day.